And Dr. Jeff Pothof, Chief Quality Officer at UW Health, joins us to discuss all things COVID, flu, and RSV today.
You bet. Quite the list.
I know, right? It gets longer every time, it seems.
Well, the vaccine fatigue, how are you seeing the ripple effect of that here?
Yeah, I think the con of a vaccine fatigue kind of phenomenon is that we'll have more individuals who get more ill from, say, influenza or COVID-19 than we would if folks were keeping up on those vaccines. Those more people getting sick means more people coming to the hospital, which we're happy to take care of them, but we'd rather they be healthy at home going to holiday parties.
We were talking about during the break, many people, they're wanting to go to the emergency room or urgent care because something's up. They get a little nervous, but we're saying now, hold off a little bit.
Yeah, I think one thing that happened is during the pandemic, we were telling everyone, hey, you need to know if you've got COVID-19 or not. And even today, that's important because if you have COVID-19, there's different therapeutics that a lot of people are eligible for can change the course of that disease. But that's not really true with these other viral illnesses. So if you test at home and you don't have COVID, a lot of people are saying, well, I'm going to go to the clinic or urgent care or the ED, and I'm going to find out, is this flu or RSV or one of these other viruses? And sometimes it's nice to know, but for folks that are thinking that, they're often disappointed because they come to, say, the ED, they wait 6 hours to see someone. We can do that test. You know, we tell them, hey, you got flu, and they expect something fancy to happen after that, but we say, hey, you know, go home, get some rest, drink some fluids, take Tylenol and ibuprofen, and we say the same thing if you've got RSV or if you've got para-influenza or rhinovirus or these other viruses. So the message is like, unless you're really sick, like you're having a tough time breathing or you think you need emergency care, don't necessarily use your time and use your money to find out which specific virus you have because the treatment is the same. So it doesn't matter which one you have if we're going to do nothing different once you have the diagnosis.
Well, speaking of the flu, I know that we've reported on some of the numbers of the amount of cases, and we keep seeing it tick up week to week. Where are we at now?
Yeah, rocket-like trajectory. So for context, our last real flu season, 2019, in February, our peak week of cases we diagnosed across UW Health was about 350. 2 weeks ago, we had diagnosed 548 during that week at UW Health, and this last week that just ended, 799.
Wow.
So flu cases are higher than we've ever really seen them. Part of that is some of this testing bias, but for sure, a lot of flu in the community right now.
What is happening? It seems like COVID came and then flu just disappeared. And then now we've opened the door to flu and RSV.
Yeah, I think, you know, as effective mitigation was against COVID-19, it was even more effective against RSV and influenza. We didn't have much of it. And now that we've gotten pretty much back to normal, we're seeing much more of these viruses that have always been there, but really on that back burner.
I'm seeing a lot more masks out and about now, and it seems like are people taking what they've learned from COVID to apply when they're not feeling well other times?
I think this is a transition that's happening. So the masks, you know, during the pandemic was really to slow the spread of the disease, and at that point it was saving lives. We didn't have any immunity, we had no vaccines. I think the severity of illness with either COVID or influenza is lower, but a lot of people are saying, you know what, I just don't have time to be sick. I got things I want to do. So when they're out and about and they know these virus levels are really high, they're choosing to mask up so that they don't get sick, so they can go to work or their kids can go to school or they can go on these holiday trips that they have planned. And I think that's something that will stick with us that we weren't really thinking about before the pandemic.
So top 2 things that you would suggest people to do, especially with big holidays coming up within 10 days.
Yeah, I think 2 big things. So one, the flu vaccine looks to be a great match against the flu strain that we're seeing.
Okay.
So if you haven't gotten it, go get it. Decreases the likelihood that you'll have symptoms, certainly decreases the likelihood that you get severe symptoms or, God forbid, be hospitalized. And then likewise, I think really good ability to not go to those holiday things if we're sick. This is hard to do. It's hard not to send our kids to school if they got the sniffles, but as much as we can, if we're sick, we have fevers, we have flu, COVID, whatever it is, stay home, don't spread that to everyone else.
All right, good advice. Thank you very much, Dr. Pothof.
Thank you.
Thank you, appreciate it.
All right, we'll be right back.